We are incredibly proud of Millard Fillmore Suburban's ICU in receiving this Bronze Beacon Award. This national award shows the nurses' commitment to compassionate, dedicated, and clinical excellence in the critical care setting.
Being the first unit at Millard Fillmore Suburban Hospital and the first unit at Kaleida Health to win it is exceptionally awesome. It reflects the high quality teamwork that really happens here every day.
It just validates all of the good work that has been done here in the ICU. We always known that they've provided high quality patient care, but it just demonstrates all the nursing best practices, the evidence-based practice that is utilized here on a daily basis. And it just really overall impacts the positive outcomes of our patients.
I think that we're all very aware that we do good work here. Knowing that our work is recognized, that we do good for our patients, we do good for our community, means a lot to the unit in its entirety.
There are 3 domains to the award. Patient outcomes, where they have to demonstrate both quantitative and qualitative narratives on the exemplary work that the nurses do. There's also nursing practice as well as the workforce. This award starts with a healthy work environment survey. So if the environment is not deemed healthy and supportive, collaborative, skillful communication, meaningful recognition, staffing, and authentic leadership, we can't even apply for the Beacon application.
This award signifies the high quality that we provide to patients here in the intensive care unit. It showcases the work that the nurses here do and the providers and the whole team, and it really shows how much pride we put into that care, that work, and our own professional development as nurses.
It's about quality of care. It's about teamwork. It's about communication. And all those things put together make this team strong and cohesive. They work together well. They anticipate the needs of the patients. They anticipate the needs of each other. And I think that when you have collaboration among the nurses and the nurse practitioners and our ancillary staff and our physician providers, all of that works together to give us the best outcomes for our patients. And then we also have really great leadership too.
Our leadership with Mike and Carrie are very, very supportive of the team, and they do everything they can to help them get through difficult and challenging times, just the way our staff help our patients get through those difficult times.
Critical care is obviously very challenging. For the staff here, they're spending half their day, 12 hours here, 2, 3, 4 days a week, helping to provide high-quality nursing care to patients and families. So it's really important that they have that supportive environment and they have a group of peers they can rely on.
Unfortunately, whenever anyone's in an intensive care unit, it's probably one of the worst times of their life, and we want to be here to get them through that and to support the patient and their family and their entire network of people that support them, and we're here to act as an extension of that support.
The ICU really is not a place that people think of as being fun, but I think for me, because of the people I was surrounded by, it allowed me to really make the best out of something that could have been very scary. They're incredible. I say all the time, there's so many things I could never do, and so to be able to kind of have the wherewithal to do that every single day and know that a lot of those stories don't have happy endings, I'm really glad that I could be one.
We do a lot of innovative things that other community hospitals might not do, like CRRT, continuous renal replacement therapy. We do robotic surgeries. So for being a small community hospital to have those kinds of things, you need to have an outstanding ICU. And we need to make sure that we can take care of those patients with the best technology, with the best knowledge, with the best nurses. When I started here as a graduate nurse 20 years ago, it was a lot different than it is today. We are constantly progressing and making things better for the community.
We are a community hospital. We are a representation of the community that surrounds this hospital.
Just really incredibly proud of the team here, proud of the work that they do, proud of the care that they provide to the patients. It's an incredible honor and very well deserved.
I am so proud of Millard Fillmore as being our first Kaleida Health critical care setting to apply for this and receive the award. They are laying the groundwork, and several other Kaleida ICUs are following in their footsteps. So more to come, and this is just the beginning of clinical excellence throughout Kaleida.